All right, welcome everyone. Today in our behavioral medicine didactic series, we have the great pleasure of being joined by Danielle Bellina, who is our senior therapist in the women's program at Princeton House Behavioral Health. And she's here today to teach us a little bit about DBT and ways that DBT can be really effective for folks that are experiencing cancer. So I'll turn it over to you, Danielle.
Thank you. So first and foremost, as Dr. Boswell said, I'm Danielle. I work at Princeton House in North Brunswick. I've been working here for quite some time now. I don't know if it's maybe like almost 7 years. So part of the reason that I feel so strongly about this and why I wanted to do this is because I myself am a cancer survivor, and I actually did a podcast with Andy Dean on my journey through cancer and using the DBT skills, as it is something that I teach almost every single day, and I have found to be really helpful for me. And the irony was that it was already kind of set in place. I already knew the skills. It was just a matter of using them. So as I said, I was diagnosed myself, which I think that gives me this dual perspective that I have when I was going through my cancer journey. On one side, I was a patient, which obviously was the forefront of what was going on. And then on the other side of it, I also was a clinician. So I got a really up close personal view of what can go on during someone's cancer journey, the thoughts that a person has, the needs that a person may have. And sadly, at the same time of me going through my journey, I also had an aunt who was going through a cancer journey who actually passed away. So I unfortunately also got to see a very close view of what it's like to be a family member of someone who goes through a cancer journey. With that said, I put a lot of thought into why DBT was so effective for me. So I really want to say too that this does not in any way cancel out the importance of processing what's going on through your journey or getting your feelings out or anything like that. But using the skills I actually found to be super duper effective for me. So I also wanted to say to everybody too, if anybody's got any questions, you could just, I can't see any of your faces, but if anybody has any questions, you could just ask me like midway through if you need me to clear something up. That works perfectly fine for me. So the first thing I wanted to explain from DBT is, what is DBT? So I'm sure everybody's heard of it in their own way. It's dialectical behavioral therapy. It was created by Marsha Linehan for the purpose of working with people who have borderline personality disorder. It is an extremely structured yet flexible type of therapy. So one of the things that's really helpful is that it has a homework component, which is how the patients that you're working with get to process what's going on with them in a more structured manner, so that it's not kind of where you don't really know what can come out. There's rules about what can be shared when you're processing or when you're presenting your homework in group. There is a DBT structure that every group or every other group, we kind of go over to set the tone as to what's expected in group, what you're allowed to talk about, what you're not allowed to talk about. So when people present their homework, they're able to get feedback from other group members, from staff members, and it needs to be somewhere in the middle. It's not supposed to be a negative or positive type of reinforcement. There's supposed to be details to it, okay? And also when teaching DBT, one of the things that I personally really love about it is that there's an element of explaining the skills in almost like a storytelling type fashion. So you get to use aspects of your life, even if they're not necessarily accurate aspects of your life. For example, if I'm trying to talk about validation or invalidation, and I'll say you're handing out cups to your children, and one gets a purple cup and one gets a green cup. Or I talk a lot about the laundry in my house, right? They may not really know whether or not that's true. And I don't give specific details about things, but the idea of being able to storytell while doing that and teaching something is it's slightly more memorable and allows the patient to kind of feel a connection or that they know something about you, even if it's kind of like a very superficial type thing. I think that that's something that DBT is really wonderful with. So I do not explain my story to the clients that I work with at Princeton House. However, I do believe that it would be important to kind of relay this to people who are going through the cancer journey themselves or people who are watching someone go through a cancer journey. So I'll explain a little bit about it as it goes on. So DBT is, Princeton House breaks it down to 5 different modules. So we have distress tolerance, and those are the skills that I think most people hear about when they think of DBT. It's most people think of it in this capacity. So distress tolerance are the skills that help you get regulated. Okay. Some of them are called the tip skill. It's managing your temperature, intense exercise, paced breathing, things of that sort. And these skills help you get back inside your window of tolerance when you are outside of your window of tolerance. So that is the distress tolerance module, kind of in a nutshell of what it does. These skills are to be used when you are dysregulated. These are skills that you can use in your everyday life, but more so you want to integrate them in a different way. They're used when you're panicking or very overwhelmed, right? The next module is emotion regulation. So this module is to teach you about the different emotions, how they serve you. If you are feeling maybe your emotions are too strong, or maybe you're not allowing yourself to feel a certain emotion. It's also a wonderful way for patients to take the distress tolerance skills and integrate them into their everyday life. So an example would be, if I'm really overwhelmed and I know that it's helpful for me to go for a walk or to exercise, maybe when I'm not panicking, I integrate these skills into my everyday life. And emotion regulation is teaching the client to aim towards the future, setting goals to get towards the future. The next one is mindfulness. This is the biggest part, I would say, of DBT and kind of as a whole, what DBT stands for. We're trying to get ourselves to be one mindful, doing one thing at a time. If we're going for a walk, our mind is invested in walking. If we're exercising, we're exercising. If I'm eating, I'm mindfully eating. In any capacity, we want to mindfully do things in one way, one simple effort kind of thing. Like our whole mind is wrapped around something, as opposed to splitting our brain, which we explain to our patients is often something that happens when we experience trauma. So the wise mind is kind of teaching us to integrate things a little bit more, mindfulness rather. The next one is the interpersonal effectiveness skills. So these are teaching our clients how to communicate our emotions to someone, communicate our feelings, our wants, our needs, and to say no to things, and how kind of harshly we may do that. Are we pushing hard to say no, or are we kind of pulling back and being a little bit more gentle in saying no or asking for something? So now Princeton House has added a 5th module in, which is actually the extension of interpersonal effectiveness. It's called Middle Path. And I'm so glad they did this because it is absolutely phenomenal. And it gives you, or gives the client, the middle ground in things, how to see things somewhere in the middle, understanding that life is not black or white, it's gray, and we need to find a little bit more of the gray. So it's an extension of that. There's a lot of validation, understanding invalidation, and also the component of trying to make friends. So from all of those things, as you can see, it has a ton of skills. So in each different category that are helpful for just about everybody. I honestly think that this should be taught in schools because it's just really effective for people to learn how to manage their emotions, right? There's not really a negative to this. So another reason that I find this to be really helpful in the cancer journey is, as I said to you, the idea of not processing. So something that I've noticed through my journey and through being a part of the cancer community in different ways is not everybody wants to hear your story, and not everybody wants to tell their story, right? So with that said, DBT gives a way of joining a group where you don't necessarily have to hear someone's story. Like maybe you're all there because you've experienced cancer yourself, or maybe you're all there because you've had a loved one who's experienced cancer. And there's a connection, but also not necessarily hearing a story where it's being processed out. So to me, that's a really big deal. Another component of it that I have noticed is, and I think most clinicians would be able to kind of see this, is when someone experiences a trauma, it's not just that traumatic experience that someone feels in that moment. There can also be a component of previous trauma, whether resolved or unresolved, if you have any, kind of comes back into play, into the forefront. Your head is kind of spinning. And I realize that for myself, and I realize that for a lot of people working here in the community that I'm in, and just in general understanding of the way trauma works. And I think DBT offers skills to help you kind of be able to contain that, to ground, because it does a lot of grounding and containment in order to manage that, because it's not necessarily the time to process that in every second of every day. So those are some things that I think of why I think it is pretty beneficial. And also, it's not just me. Princeton House also kind of has similar thought process, that one of our rules here in the women's program is that if a person is actively in trauma, we don't allow them to be in the trauma group because we're trying to keep them safe. And sometimes your trauma symptoms actually help to keep you safe, right? Hypervigilance can keep you safe in some capacity. So we don't work to kind of take that away. It's one of the rules that we have here at North Brunswick. So does anybody have any questions about any of the things I said so far before I explain to you some of the skills as I see them through a lens of a cancer survivor? All right. I will move on. Okay, so the first skill that I want to go over comes out of the mindfulness module. It's mindfulness handout 3. Also, we all have access to this. This is Princeton House's creation of their DBT binder. So all of the material that I'm going over today, separate from my own personal story, is Princeton House's material. So Penn Medicine, Princeton House. So it's called Wise Mind. And the way that I teach it, when I teach it to patients, is if you imagine a transparent yellow circle and a transparent blue circle. And when you were a little kid and you were learning how to make secondary colors from primary colors, and when you overlap them a little bit, there is an oval of green. Okay, so that's the idea of, if you can conceptualize that in your mind, of how Wise Mind kind of works. So over in the yellow side, there might be reasonable mind. Okay, so reasonable mind in the cancer world is kind of like, thinking to yourself, you get a diagnosis. I myself, right? I find out, okay, I'm stage 1. There's treatment that could be done. I can get surgery, the statistics of how I can survive, right? So that's reasonable mind or rational mind, right? So that's just no emotion connected to it. That's all logic all the time. They consider it to be cool, rational, task oriented. It's facts. It's basically logic, pragmatics, and fact based. Okay. That is reasonable mind. But then we have on the other side emotion mind, which is that blue circle, right? It's hot, it's mood dependent, it's emotion focused, right? You're ruled by your moods, your emotions, your urges. Facts and logic go out the window, right? So in that aspect, this is where, oh my God, I'm scared. I don't want to die. I want to be able to live. What's going to happen to me? I'm going to lose my hair, right? There's a lot of emotion and a lot of fear. It's really difficult to pull yourself back when you're having those types of feelings, right? So what do? Because both are real. I could be really frightened, which I was, and I can also understand that I'm going to get treatment and that I'm going to be okay. Neither one needs to be canceled out. And the idea of Wise Mind, it is that little green section where both are valid. right? So what we teach our patients is that you don't have to pick between emotion mind or reasonable mind. You can be somewhere in the middle, which is wise mind, right? So when I'm making decisions, I'm going to make decisions from a wise mind perspective. And this essentially, this skill is where we try to find patients who are working with DBT and going through the process. We want them to start to think from their wise mind. It's referenced a lot in other DBT skills because it's a state of mind, basically. And it's respecting both sides in a situation. I can be afraid and also know that there are options for me. Okay. So, that, in my opinion, is why wise mind is a very effective skill for someone going through just about any trauma, but really in the perception of a cancer journey. So Wise Mind, again, is from the mindfulness handouts. Does anybody have any question about Wise Mind? Okay. The next one I'm going to pull for you is from distress tolerance. Okay. So distress tolerance has a lot of different aspects to it. So, distress tolerance has the tip skills, which are, like I explained to you before, temperature, intense exercise, paired muscle relaxation, those types of skills that help you get back inside your window of tolerance, right? They help regulate your body chemistry, bring you back down from wherever you are. It's the dive response is what we're trying to activate and using aspects of the tip skill. But it also has other really great gems from it. So one of the ones that I really love is radical acceptance. So radical acceptance is a really difficult thing to teach. I don't think that typically when you teach this to patients, it's not usually anyone's favorite skill. It's challenging, and sometimes I think people can perceive it as um, invalidating because we're trying to tell you to radically accept something. It is not intended in any way to be invalidating. So I'm going to explain it to you in the context of from a cancer lens. So it's distress tolerant handout 11, and it says, what is radical acceptance? So radical means all the way, complete and total. So that's the idea. We have to completely and totally understand that this is where we are. Avoiding reality does not change reality, right? So it says it's when stop fighting reality, stop throwing tantrums because reality is not the way you want it, and let go of bitterness. I talked about this on the podcast as well, but the example that I gave actually for radical acceptance is it was really challenging for me to lose my hair when I was going through chemo treatment. And I tried everything I possibly could to avoid it. And I explained on the podcast that I tried to only shave a portion of my head, right? And what that left me with was matted hair on the top of my head. So, as much as it was really challenging to do that, understanding that my avoidance and it was just me trying to protect myself and not fully accepting that I had no control over whether my hair was going to fall out or not, kind of put me in a position that I was not really happy with at that time. Didn't get to make that choice so easily after that. I had to do what I needed to do. Um, However, not fully accepting it did not change it. It did not mean my hair was not going to fall out because I was not ready for that to happen. And it sounds harsh, and it's my story to say that. But it's the truth. And sometimes we have to understand that as much as we don't like a situation and we try to avoid it, it does not change the situation. It just really makes it harder for us, right? So it says what has to be accepted. And I think this is really important. Reality as it is. The facts about the past and the present are the facts, even if we don't like them. I didn't like that I was going to have to shave my head. I didn't like that I was going to lose my hair. It does not change the fact that I needed to do what I needed to do and that that was going to happen anyway. Right? Why I think radical acceptance is really helpful, not just for me in the scenario that I'm explaining, but because it's a really difficult thing for people to understand that they now have this diagnosis, that this is the way life is going to be, or feel for a period of time, right? And the more we try to avoid it, the harder it becomes for us. And this is with anything that's traumatic, right? But it's a very important thing to try to accept. So it gives some examples of why accept reality. Rejecting reality does not change reality. I think we all know that. Pretending that I didn't have cancer didn't mean that I didn't have cancer, right? I needed to do what I needed to do. Changing reality first requires accepting it. And with accepting it, you get the ability to change how you feel about it, okay? If I accept that I have to do treatments, I get to decide how I feel about doing those treatments. I get to create a plan that I'm comfortable with, right? So it's teaching those types of skills and why we need to be able to wrap our head around something to change what it means to us, right? Rejecting reality turns pain into suffering. With the example I gave, I was rejecting the reality. And again, this is my journey, and there's nothing wrong with me not wanting to shave my head. And there's nothing wrong with anybody else feeling that way and struggling with it. I'm just using this as an example in the context of DBT. But as I gave you, it didn't mean that my hair was not going to fall out. It didn't mean that I wasn't sick just because I was rejecting that as a reality. Refusing to accept reality can keep you stuck in unhappiness, bitterness, anger, sadness, shame, and painful emotions. And I found for myself, and I find for most people that we work with through Princeton House, is when you try to avoid painful emotions, they increase typically, right? And when you start facing them, it does make you feel sadness, and there's a sense of loss, and then there's a sense of relief, right? And I can only speak for myself on this, but understanding that when I was able to accomplish what I needed to do in my journey, I kind of found that I was able to follow what was recommended to me. I was relieved that I didn't have to hold on to this anymore. I didn't have to try to change it for myself. So the last part of this one that they give an example for is the path out of hell is through misery. By refusing to accept the misery that is climbing out of hell, you fall back into hell. And I often modify this one because I think sometimes it comes off a little aggressive when I'm explaining it to the patients, but I modify it and think to explain it as if you fell in a well, right? And you looked up and there's a way out, you can climb out of the well, right? But you're really afraid of spiders. And you look and there's a section of the well about this thick all the way around that's covered in spiders. Do you say to yourself, nope, not leaving, I'm going to stay here? Or do you say to yourself, I have to accept that I've got to get past the spiders in order to get out of the well? And sometimes we have to pass through things that don't feel great for us to get to the other side of something. And in my journey, I had to accept what was going on with me in order to get the sense of relief and the feeling that I had of no longer needing to be in full control. So this is the idea of the concept of radical acceptance as it pertains to my cancer journey specifically. Does anybody have any thoughts or any questions about radical acceptance before I move to the next skill? If I'm talking too fast for anyone, you can also let me know that too, because I am like a speed talker. So let me know if you need me to slow down. All right, so radical acceptance is part of distress tolerance. The next skill that I want to go over for you that I would like to explain a little bit is the stop skill. It is also part of distress tolerance. It's handout 4. The way that DBT runs is a lot of the skills are acronyms. And they're really helpful way to remember the skills. So the stop skill, it talks about what to do when you're in that fight or flight type moment to kind of bring yourself back down and really think about how you want to respond before you respond. Okay. So I'll explain it to you. So It's broken down with S as stop, T, taking a step back, O, observe, P, proceed mindfully. Okay. So S, do not just react. Stop, freeze. Don't move a muscle. Your emotions may try to make you act without thinking. Stay in control. The way I often describe this and why, again, I find this to be effective is that the stop skill for me was really helpful when I was in a situation with medical providers. Okay. Because my natural instinct was I wanted to get up and run. Yeah, I don't want to be here. I don't want to talk to anybody. And I loved my doctors, but I did not want to be there. Right. And I had to think, was I going to go with my urge or was I going to go with what was the more beneficial thing to do? Well, before I can even make that decision, I need to stop myself and not react. Take a breath, take a step back, right? So take a step back. Take a step back from the situation, take a breath. Let go. Take a deep breath. Do not let your feelings make you act impulsively. It is not a good idea to get up and run out of the office of where I am, right? I need to breathe and take a step and just kind of see what's going on in my body, right? Which brings us to observe. Observe. Notice what's going on inside or outside of you. What is the situation? What are your thoughts and feelings? What are others saying and doing? So this was helpful for me in two ways. One, what am I feeling in this moment? I always share with the clients when I teach this skill that anytime I don't like going anywhere, I do jumping jacks or I run in place, and I'm always wondering, like when you're waiting, if you're going into the doctor's office and they put you in that little room and you're waiting there. And I always laugh to myself that one day they're going to come in and find me running in place and be like, what is she doing? But in reality, it's kind of me understanding that my heart rate is going up, that I have this burst of energy, my fight or flight is kicking in, and I am not able to do anything other than get it out in some capacity, right? So it's not helpful for me to process it in this moment. I need to get up and move. So these are the type of things that are effective for people. Some people need to stretch. Some people are hot. They need to cool their body down. I need to observe what's going on inside of me and give something to it to help resolve or even lessen that to some degree, right? Then the other observe, because that's my side of it. The other observe is what's going on around me. And I found this to be absolutely amazing because you know what? I teach skills every day, right? I teach mental health skills. I work with people. So when someone presents something to me and they are having an issue mental health wise, it doesn't typically frighten me because I do it every single day. But I also understand that patients who come in are frightened, right? It's not what they do. Now, if I put myself in the position and I'm at a surgeon's office or an oncology office, I'm scared. This is not what I do at all, right? So just as much as a client looks for me to be grounding and understanding that I am steady, I'm the steady thing in the room, I looked for them for that as well. So what I would do is I would look around and every single time I would joke with them, they'd ask me how I was, I'd tell them I was nervous, I asked them how they felt. And I would say to myself, because I had calmed myself down, I worked like to see things more clearly and to be inside my window of tolerance. And I would say to myself, they're not frightened. This is what they do every day. No one looks worried. This looks like just a regular day for them, right? And it really helped me feel more confident in what I was doing, which gave me the ability to proceed mindfully, act with awareness in deciding what to do, consider other people's thoughts and feelings in the situation and think about goals. Ask wise mind, like I told you, it always reflects on wise mind, which actions will make it better or worse, right? If my action urge is to get up and run away, will that really help me? Right? Is that a wise mind decision? Can it be okay that I'm frightened and that I could still proceed here? So this is the stop skill, and it is part of the distress tolerance module. It's handout 4, and it is invaluable. It is amazing and fantastic, and I love it so much. Anybody have any questions about the stop skill? Okay. So what I want to present to you next is turning the mind, because it's kind of, if you look at it as the little sibling, the next thing over from the stop skill, right? Because how many times do we understand that we need to stop ourselves, right? How many times does this happen before we kind of create a new neural pathway where I don't feel like I'm going down that rabbit hole, right? So turning the mind is a distress tolerance skill. It's handout 12. And the idea behind it is kind of to create the new neural pathway, right? To understand that there is rejection and there is acceptance, and that we're going to keep coming to the fork in the road. But every time we go down the acceptance road, it becomes a little easier for us to accept. Every time I get anxious, my brain gets a little more tuned into the skills I want to use as opposed to the fear that I'm feeling, right? So turning the mind is like facing a fork in the road. You have to turn your mind towards the acceptance road and away from the road of rejecting reality. And let me tell you, there were many times that I felt that I wanted to reject reality during my journey. And I don't think I am alone in that. If you were to ask anyone in the cancer community, I think that every single time I went to a doctor's appointment or I went to a chemo appointment, I would desperately not want to go, and I would cry and feel really anxious. I used a different DBT skill, and decided to do something positive to get me there, to make it more interesting for me to be there, or positive in some sort of joyful way, bringing a little treat or telling a story or asking the doctor about something going on with them in their life that I know, or talking to the nurses were kind of how I was able to do that. But every single time I needed to turn my mind. And I don't think I'm alone in that, just in general. So it says turning your mind is choosing to accept. There's a radical acceptance component in turning your mind. You are choosing to accept it. The choice to accept does not itself equal acceptance. It just puts you on the path. So saying to yourself, I'm going to accept this. That's it. This is where we're at right now. Doesn't mean that I fully accept it. So how do we do this? Step by step. We observe that we are not accepting. We look for anger, bitterness, and annoyance, avoiding emotions, saying, why me? Why is this happening? I can't stand this. It shouldn't be this way. And, you know, this is not even something that I'm saying on my own. This is just the way the skill is written. And it just perfectly fits someone who's going through this specific journey. It says go within yourself and make an inner commitment to accept reality as it is. You have to really dig deep and say to yourself, this is where I'm at. This is what I'm going to be doing, and kind of accept it despite the fact that every part of you does not want to. And I think that something that happens with people who are experiencing a cancer journey is that you are taught not to put yourself in danger, right? And in the same respect, the cure, the solution is also itself a problem, right? So whatever treatment or surgery you're doing, it doesn't make you feel good. So you're going against what you feel is your better judgment. So it's not just a matter, what's special for this type of community, it's not just a matter of like, I have to do the opposite of something. It's more, I have to do the opposite of something despite knowing that I'm going to feel really sick from what I'm about to do, right? So it becomes more challenging, and turning the mind is very important to understanding that there is that fork in the road, and I keep choosing acceptance. And then you do it again. You do it over and over and over again. You keep turning your mind to acceptance each time and come to the fork in the road, and just again, acceptance, acceptance every time reminding yourself where you are. It's actually part of why I personally do not mind telling my story, and why I feel so strongly about giving back in this way. It also keeps me accountable. It doesn't allow me to sit still and really worry, because I'm in it. It's my reality. It's part of who I am, right? And I think that's a big part of it. Your life changes when you hear those words, and it doesn't necessarily go back to normal because you create a new normal, right? So it says develop a plan for catching yourself in the future when you drift out of acceptance, right? When I can't accept this, how do I bring my mind back to accepting instead of rejecting? What are the things? Can I tell myself? What can I do? Who can I call? Who's part of my plan? Do I call a loved one on my way there? Do I listen to music? I liked bringing treats. Do I bring a treat? It helps me accept it. I may not like being there, but I'm doing something with it while I am there. So that is the concept of turning the mind. So you observe, you make an inner commitment, you do it over and over again, and you develop a plan for yourself. And that is turning the mind, the little brother of the stop skill. Does anybody have any questions about turning the mind or anything that I've gone over so far? All right. I am going to go over for you the tip skills because I've talked about them. So I feel like I should maybe give you a little bit more about it. So the idea behind the tip skills is to regulate your body. When your frontal lobe has shut down and you are in fight or flight, and we are trying to turn your frontal lobe back on so you can make decisions and think more clearly, what we have to do is kind of it's not a conversation. It's more of get your body back in line, right? We have to physiologically get you back into homeostasis to some degree, I guess. So the T is tip the temperature. So what you would do is you get a bowl of cold water, or even we teach people to put an ice pack on their neck. When you're going into a situation you know is going to be triggering, maybe some cold water to help you kind of keep calmer. Wear layers, keep yourself nice and cool. The air conditioning, going outside is a great time to use tip. But you put your face in a bowl of water and you hold it for 30 seconds. It's not supposed to be below 50 degrees Fahrenheit. And you also have to make sure that you're medically cleared to use this specific skill. The reason why we do this is it triggers the dive response, which allows your brain to think that it's underwater and drops your heart rate. So it's an actual biological thing that we try to do for our body. The I of tip is intense exercise. So running in place for just a short period of time, doing wall sits, jumping jacks, lifting weights, whatever it is that allows you to kind of expel some of that energy that you have for yourself. So I explained that I do this every single time that I go into a doctor's office. I kind of run in place while I'm waiting for them to come in there. I move my arms just to get rid of the energy. And then the next part is 2 P's, actually. It's TIPP. And the first one is paced breathing. So breathing deeply into your belly, so diaphragmatic breathing, keeping a steady pace on average 5 to 6 breaths per minute, breathing in, maybe holding for a second, and then breathing out even slower. But you breathe in through your nose, you hold for a second, and breathe out through your mouth. I think everybody does this a little different for themselves, what works for them. And then paired muscle relaxation. So the idea is while you are breathing into your belly, you tighten your muscles, hold for a second, and as you breathe out, you release. And sometimes you could do a little bit of a mantra. I'm safe. Breathe out, and you kind of feel that tension relieving, like releasing from your body. So that is TIPP, the tip skills. So these are important things. You don't have to do every single one every single time. You should make sure that you're medically cleared. Sometimes people, if they have, it does talk about if you have a low body weight, you have to be careful of that as well with the exercise and things of that sort. But that is the tip skill. I don't know if anybody has any questions about that. I have a feeling that you do not. But I'm going to change it up a little bit, and I'm going to go over the dialectics because I think this is a really important one as well. Dialectics come from Interpersonal Effectiveness, handout 15. Why are they there, the dialectics? Because the interpersonal effectiveness and the viewpoint of that is being able to see more than one side of something, understanding that there's more than one way to solve a problem. There's more than one way to view a situation, right? So some of the things that DBT teaches us about dialectics is asking wise mind what's missing. So where is the kernel of truth in the other side of a situation? So if I'm too heavily in rational mind or too heavily in emotion mind, and I'm finding myself kind of in those zones, what is the missing piece here? Right? Why can't I calm myself down? Why can't I express my emotions related to what's going on around me? What is the missing piece? What is the kernel of truth, right? Letting go of extremes. No either or. You want to change that to both or and, always and never to sometimes. I think that's a really big one. I think that there's a lot of extremes when we're going into this. This is going to be the worst experience of my entire life. I'm going to be so sick. I'm never going to get better. And it's a lot of more gray areas. And I think that there's a place to feel that fear. And also there's a place to live a little bit more in the gray area, because sometimes the fear overwhelms us and becomes taking charge, right? Balancing opposites. Another one that I noticed for patients that's really difficult is making lemonade out of lemons is one of the ones that I think is difficult. And because it sounds invalidating, just like radical acceptance, where it can kind of feel like, well, great, you went through this journey. Now, what did you get from it? Like that kind of silver lining type viewpoint, which is not always the most effective. However, it's true. Sometimes we can make lemonade out of lemons. So an example of this is that me doing this right now is my lemonade out of the lemons I was handed. I have a very different perception of life because of it. And I made lemonade. Helping a person figure out what their lemonade is, even though life feels like a bunch of lemons at the moment, is actually a really beneficial, important thing to do. And it's a way of thinking dialectically. It's another thing. Let me see what else is that I would really like to. Another one I think is it talks about throwing yourself into change. And the way I would kind of modify that and embracing change is understanding that things are changing. They're going to change. The way you maybe look change, the way you maybe feel changes, the way you see the world, your future may change for you. And understanding that dialectically, how do we find a positive in that? How do we look at it as change doesn't always mean a negative, right? Can we take small steps in change? You know, an example I have of this is a lot of people recommended to me when I lost my hair. I didn't do this, but a lot of people did recommend to me, what if you get fun wigs? What if you change it up? You know what I mean? It's that kind of concept of like, what if you take something that normally has this overwhelming connotation or fear related to it, and you modify it in a way that works for you. And it kind of lessens the blow, and it makes you change kind of be less instantaneous, right? I had a lot of different hairstyles when my hair was growing back. That was my way of respecting small changes, right? And thinking for yourself, what are ways that we can control a situation even though we're not in control? Like, what can I change to make me feel I have more control in a situation where I really, really don't, right? And I think that's an important concept. It gives people back the feeling of having control. So I don't want to give too many different things to go over. So at this point, I think it's a good time. If anybody has any questions, any thoughts, anything I can further explain, that I'll open it up to you guys and see what your thoughts are. And I hope I've done a good job of at least conveying and using my story, because it's a fine line. You know, I'm able to do it here. I don't necessarily do this with the clients that I work with, but it's an important thing to kind of be able to see two sides of something, to understand that these skills were really helpful for me in my journey and why they can be really helpful for other people, and also the benefits of them clinically as a clinician. So anybody got any thoughts or questions or anything?
Thank you, Danielle. That was a wonderful presentation.
Thank you.
And I'll speak first to say that I thought you navigated, like, talking about your own story and the skills that can be useful for folks with similar experiences so beautifully. I'm
Thank you.
really thankful that you were willing to share both of those things with us. And it looks like we have a question in the chat from Yasmin. So she's asking, do you have tips for how to balance radical acceptance with invalidation of the cancer experience, especially if you're a clinician that has not had a cancer experience?
Yeah, see, that's the thing, is like, I can convey it to you through my cancer experience, but like when I'm working with a patient, they don't know that I have had cancer. So I get it from that end as well. And I think just calling it out is really what's most helpful. Like I say to the patients a lot, radical acceptance, does it feel invalidating for you? You know, what feels invalidating about that? It's being very transparent in that way, because even if something like, even if to say this is the situation you're in, it may not feel great to hear, but it's also the truth. And it's our job clinically to not fragilize a patient. And I think that's an important thing too, is like, I got this perception when I went through my cancer journey. It's almost like people perceive you as this fragile thing, you know, because you almost sometimes look the part, or people feel scared or sad and they don't want to be in your shoes, or they don't want to see you go through it, right? So sometimes people fragilize you, but in reality, you're still a person, right? You're still a person who's living through things. So it's not insensitive to say this is what's actually going on. It would be insensitive to say you don't have a right to feel a certain way about it. Does that make sense to answer that question? That like both things can be true. You know, you're going to be okay. And also it's scary as hell.
Yeah, it's a great answer. What other questions do we have? Feel free to unmute yourselves, reveal your faces. Let us
I'd
know
love
what your
to see you all. I'm so used to this though, because all through virtual, it's like, but I want to be like, are you there? Because I'm so used to saying that in program. Any other questions? I don't mind answering truly, like you will not offend me in any way. So
I have a question, Danielle. Since we have a newer program at the Cancer Center, I see Kara's on the call. What would it have meant to you if someone had said, I see you jumping up and down, I know you're nervous, what can I do? Or like intervene in the moment, even though you knew skills, not everybody does.
a lot. It would have meant a lot to me. I couldn't understand sometimes why, like, I would be somewhere and it would be annoying to like someone that I was nervous. And I thought to myself, if you were in my shoes, wouldn't you feel this way? And I think just that like genuineness of like, you look nervous. Is there anything I can do with you or for you, you know? And understanding that like, it's okay, you're jumping up and down. You know, it's okay for someone to ask that. It's okay to be nervous. It would have meant a tremendous amount to me. And genuinely, like having had DBT, if I had it, it was so helpful for me. Again, because it's like, I don't always want to hear someone's story. And a lot of times in like support groups with cancer, I'm hearing things. I go to events now and people are telling me things I don't even want to hear, you know, and that's not abnormal for me. Like it's actually even challenging to make friends in the cancer community because no one wants to hear the other story, right? So why DBT and the way that the groups are structured is so valuable is because I don't have to hear your story to learn the skills, but we're all here for the same reason. So there's a camaraderie. And if I want to touch base with you, or you want to touch base with me, we can do that, but I don't have to sit here and hear it. But I do think as clinicians, as nurses, as doctors, it is very important to address that the person looks nervous, you know? And I definitely got both sides of that. So it would have meant a lot to me for someone to say that. But fortunately, my doctors kind of went along with me, and they get gifts every time I see them. I bring them like a little something, and it helps me, and they know not to question it anymore. It's what I do. You want me to cry? No, then I'm going to give you a gift.
Get the best patient ever award.
Right? Bundt cakes for everyone.
Hi, Danielle. This was so timely for me. I'm a psychologist in the eating disorder unit, but my mom is undergoing chemo right now. And I'm going to be one of those really annoying people who doesn't have a question but has a comment. I just wanted to piggyback and share that, like, even this morning, my mom had to go to the hospital, or had to be admitted, and she really didn't want to be there. You know, she's been there kind of in and out for a long time, and she's over it. And I taught her over the phone, willing hands. From DBT, just like, can you, in your hospital bed, can you open your palms to the sky, and can you essentially stop resisting reality and do a little bit of surrender and openness to what the doctors are saying? And we talked later in the day, and she was like, I'm willing hands, I'm willing handsing it, I'm doing it. And it was just a sweet little language for us to have, and a way for her to kind of turn her mind. And so I just wanted to add that.
I love that. I love that so much. And it's true, because it's becomes like a little bit of a mantra, you know, and it is overwhelming. And I wish your mom the absolute best. And if you ever needed to reach out to me or your mom, you always can. I steer people in any direction that I can, but that's awesome. Yes. Anybody else? Any thoughts, questions?
Another one. I'll ask another one from the non-clinician role side of things. Caregivers, or the person who comes with you. I think the person with the diagnosis sometimes has to take care of themselves and the other person because they can't handle it. And what's the best way to approach the other person? Because the person with cancer, in this case, it might just be full, like might not be able to take care of the other person.
So as a clinician, what's the best way to like approach the caretaker? Okay. Reminding them that the person who's struggling with cancer is who they were before cancer, and is who they are during cancer, and is the same person, right? So again, with that whole aspect of fragilizing them, I think that what's difficult for someone, and really, this is going to sound crazy to say, it was actually easier for me to navigate my own journey than to navigate what it was like to live through a loved one, because I was not in their own body, and I don't know how they felt, what was needed for them, right? So reminding the caretaker that the person who's going through cancer is who they are, right? They're not made of glass. It helps to kind of reduce the anxiety in the situation. It's okay to ask. It's okay to have your own time. Please step away if you need to. If you don't want to go to chemo that day with the person, please do not go. That is okay too. Your feelings are very important. And I understand that someone's going through a journey. Reach out for help yourself, because you are just as important, or you're not going to be able to even be supportive. It's incredibly difficult, I really believe, to be a caretaker in this situation. But reminding that you are not, there is a whole medical team with that person. You're not in it alone, and you don't have to feel the weight of the world, is kind of the way I would approach someone from that angle.
Yeah.
And I actually got lucky because I went through, this is going to sound off, but I went through during COVID. And what was really helpful for me is that a lot of people were not allowed to be with me during chemo. And I rather liked that because I wanted to so desperately protect them. And I didn't have to do that there. I was with the nurses and I made friends, right? But it's okay. That's okay for a person to have their own. My family was allowed to struggle too. To apply for these skills for a client who is struggling with long-lasting pain, fatigue related to their cancer. Yes, I think that's hard because it's kind of the acceptance of this is the way things are and the fighting of not fighting that it's going to be like this. It's very unfair. I also feel like the tip skills are helpful with the aspect of like the pain and kind of, it's more, I didn't even really talk much about this, but the emotion regulation skills, I think have more towards the future and coping with what life then would look like. What are my goals? How do I see myself, even though I have these long lasting pain and struggles? What do I see my life looking like and what skills do I use to get there? And emotion regulation has those in there. It's challenging though. That one is really hard because it's again that radical acceptance piece of it's where you are, but then how do we change our reality to be something more productive for ourselves other than kind of living in that and feeling like horrible about it, because what you went through this entire journey and then you don't want to feel like for what, you know? So looking to the future and creating things that you look forward to that you're capable of doing despite what you've been through.
Thank you.
We have time for one last question, or we can say thank you to Danielle. Any last thoughts? Great. Well, thank you, Danielle, so much for joining us. This was a really wonderful discussion and one that I think we'll be thinking about over the next few weeks, especially for our clinicians in the Cancer Center. And really appreciate your time and experience with us.
Thank you so much for having me do this, Dr. Boswell. And thank you, Barbara, too, because I know you're a big part of this. And thank you to everyone for hearing me out. Send
Thanks
people
so
our
much.
way.
Oh, we will. Talk to you soon. Thank you so
Bye,
much.
everybody.